Hello, welcome today, this afternoon. How are you doing? I'm Vincent Obita. I'm going to show you how to do an intramuscular injection for the OSCE skill presentation. This is a home setup skill, and you are supposed to locate your patient and also administer the medication that have been prescribed by the general practitioner. Now, before you commence, locate your patient's home. Now, is this 2 long streets?
Yes.
Okay, and is this Miss Emma Hargreaves' home?
Yes, this is Emma's Harvest Grow.
Okay, and are you Emma Hargreaves?
Yes, I'm Emma.
Okay, that's very fine. I'm Vincent Obita, a community health nurse, and I'm going to take care of you today. Can I get in?
Yes, of course. You're welcome.
Thank you very much. Okay, I'll check my scene for any dangers, any spillage that can deter my care. My scene is safe to approach. I approach it, do my hand hygiene using 7 steps of WHO. So, Emma, as I said earlier, I'm Vincent Obita. I'm a community health nurse, and I'm the one going to take care of you today.
Yes, I was expecting you.
Okay, thank you very much. Okay, before we proceed, can I confirm a few details with you?
Of course.
Okay, kindly your full names.
My name is Emma Hargreaves.
Okay, and your first line of address?
2 Long Street.
Okay, and your date of birth?
26/9/1963. I'm 57 years old.
Oh, thank you very much. I have the right patient. Now, do you have any allergies?
No.
Okay, to medication or food components?
No, I don't have anything.
Okay, and to any plaster or latex?
Not, I guess so.
Okay, that's very good of you. And are you in any pain right now?
No pain. I'm very comfortable.
Thank you. I'm happy to hear that. Now, Emma, do you know why I'm here today?
I think you are going to poke me with some injections.
Yeah, today I'm here to give you an intramuscular injection called hydroxycobalamin. Have you received this medication before?
Yes, Wilson. I remember it taking before 3 months.
Yeah, it's supposed to be given 3 months. After every 3 months, remember, we've been managing your anemia. Is that okay?
Yes.
Okay, don't worry. Now, when you received it last time, was there any reaction?
No, I was fine. Just a bit of pain on the injection side.
Okay, sorry for that. And which side did they use to give you the medication last time?
If my memory was not so good, I think it's on the right side.
Okay, that's fine. And you said there was no reaction. I'm happy to hear that, okay? Will you be comfortable with if it was on the left side?
Of course, I'm happy.
Okay, thank you very much. Now, let me prepare my equipment, then I'll be back. Is that okay?
Yes.
Okay, then.
You can use my washroom.
Thank you very much. I do my hand hygiene. Okay, and I go back to my preparation area. Do a full hand wash using soap and water. Open the tap, wet my hands, put sufficient amount of liquid, the detergent, and do palm to palm, palm to dorsum, finger interlaced, finger interlocked, fingertip rotation, thumb rotation, wrist rotation, rinse. Close my tap, then using the paper towels, dry my hand from top to bottom to the general waist. My hands are clean. I do my apron. Now, assessor, I have here prescription of today. Time is 14:00 hours. The prescription is for Miss Emma Hargreaves. 2 Long Street, date of birth 26/09/1963. Patient has no documented allergies, and I'm going to administer hydroxycobalamin 1 milligram per ml. The GP has prescribed 1 milligram, so that's 1 ml. It's supposed to be given intramuscularly, and this is administered after every 3 months. The patient received the last dose 3 months ago, so it's due. Then this prescription has been done by John Adams. The date is today. The signature is there. So my prescription is both valid and complete, and it's also legible, so I'm happy to use it. Now, I'll require hydroxycobalamin. Here I have hydroxycobalamin 1 milligram per ml. Expiry date is 04 2024. So I'm happy to use. There is no precipitate and it's clear. I'll also need a 2cc syringe. Here I have 2cc syringe, expiry date 2025. It is intact. I'm happy to use. I'll also need a clean dry gauze. Assessor, can I use it?
Yes, it's safe to use.
Thank you. I'll also need a chlorhexidine wipe. It is intact. Expiry date January 2023. I'm happy to use it. I'll need a plaster. It is intact. I'm happy to use it. Assessor, it has no expiry date. Can I go ahead and use it?
Yes, still it's safe to use.
Yeah, thank you. I'll need administration needle. That is intact. Expiry date is 2025. I'm happy to use it. I'll also need a preparation needle. It is intact. Expiry date 2025. I'm happy to use. I do my hand hygiene. I put on my gloves to prepare my medication. Now I'll clean the top. Using the chlorhexidine wipe, I'll clean the top of my vial for 30 seconds. Now, assessor, I'm going to administer this medication intramuscularly to the deltoid muscle, that is 2 to 5 centimeters below the acromion process, to the patient. My 30 seconds are over. Then I'll wait for it to dry for 30 seconds. I discard this in the clinical way. Then now I prepare my syringe. Here is my syringe. I partially open it. Then I also open my preparation needle. Connect the two. Then I remove the cap, place it on the tray, and puncture my vial, lift it to a higher level, withdraw 1 ml. Assessor, I'm supposed to have 1 milligram, and that's 1 ml. I'll withdraw 1 ml of hydroxycobalamin. And using one hand non-touch technique, I scoop back my needle cap. Then remove any excess bubbles. Assessor, can you confirm with me that I have 1 ml of hydroxycobalamin?
Yes, it's 1 ml.
Okay, thank you very much. Then now I'll place it on the tray, open my administration needle, and I'll remove the preparation needle, place it on the shaft box straight away, connect my syringe containing hydroxycobalamin to the administration needle this way, then place it on the tray. I'll now place all the other materials on the tray, including my drug and a pair of gloves and my hand gel. Then I remove my gloves to the clinical waste bin, do hand hygiene. Okay, then I go back to the patient. Hello, Miss Emma.
Yes.
How are you?
Okay.
I'm now back. Are you happy we proceed with the medication?
Of course, we can go ahead.
Okay, and kindly before we proceed, let me confirm your identity. Kindly give me your full names.
Ima Hargreaves.
Okay, and the first line of address?
2 Long Street.
Okay, that's okay. And your date of birth?
26/9/1963.
Thank you very much. So I have the right patient and proceed with the medication. I'll now do my clean gloves. I'll do my clean gloves, then I'll clean the site of injection using the using the alcohol wipe for 30 seconds. Okay, now Emma, do you know any signs? The medication I'm going to give you, okay, might have some side effects. Is that okay?
Yes.
Yes, so some of them include
What is that?
the slight side effects of that might include stomach upset, okay? You might also get some nausea, okay?
Okay.
Yeah, and things of that kind. In case of such, just alert me. Is that okay?
Yes, okay, I will tell you.
Yeah, okay. So my 30 seconds are over. I'll wait for it to dry. I'll wait for it to dry as I prepare my medication.
30 seconds are finished.
Okay, thank you very much. Now, I'm going to give this medication 2 to 3 centimeters below the acromion process on the deltoid muscle. Before I puncture, I'll stretch my skin. First, I'll remove the cap, stretch my skin. At 90 degrees, introduce my needle and leave only 1 centimeter remaining to be seen, okay? Then I will aspirate for any puncturing of a blood vessel. There is none. And with that, I push my medication within 10 seconds. So that is 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Then I'll wait for further 10 seconds for it to be absorbed, okay? That is 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0, okay? Then I withdraw my needle, use the security feature to secure my needle, then put it on the sharp box straight away and apply the plaster, apply the gauze immediately on the site without massaging, only applying the pressure for 10 seconds. So Emma, how are you feeling?
A bit pain, but I can tolerate.
Okay, don't worry, it will go away soon. Is that okay?
Yeah.
Okay. Okay, then I'll check the site. There's no any sign of bleeding, so I won't place a plaster. Otherwise, I would have placed a plaster to curb any bleeding or to provide sufficient pressure. So Emma, I'll go discard my materials, then come back. In case you need me, just shout my name. Is that okay?
Fine.
Okay. Then I leave, go back to my preparation area, clear all my equipments, discard all the stuff that I've used to the clinical waste bin, remove my apron, remove my gloves, decontaminate my hands, and sign my medication immediately with my signature. Date is today and time 4:00 hours. Okay, then assessor, I'll now go back to my patient. Now Emma, how are you doing?
Yeah, okay, I'm fine.
Yes, now we are done and thank you for your cooperation. Is that okay?
Thank you so much for coming to my home and giving the injection.
Okay, thank you. So in case of the signs that we talked about, in case you feel any, just kindly alert me. I'll be around for the next 30 minutes, okay, to watch for how you are doing with the drug, okay?
That's appreciable, okay.
Yeah, and in case of anything, just alert me. Is that okay?
Sure, of course.
Okay, thank you very much.
Thank you, Vincent.
Okay.